Today we're going to be talking about renal calculi, which are better known as kidney stones. And these are types of obstructions or can function as an obstruction in the urinary pathway. They can either occur in the ureter on either side, the right or the left side, or they can occur lower within the urethral area, or they can actually block or cause an obstruction within the bladder itself, depending upon the size of the kidney stones. So what we first want to talk about today are the different types of stones, and there are several. The first is called a calcium oxalate stone, and it's exactly what it says it is. It is a stone that is composed of calcium deposits and that crystallize and can form an obstruction in the urinary pathway. The stones actually can range in size and shape. Some can be very small or minute, almost very difficult to see with the naked eye. They may be expelled by the client and look like a grain of sand, or they can be much larger and much more solid. Next, we're going to talk about struvite, which is another type of kidney stone. The struvite stones are made of magnesium ammonium phosphate. Okay, and we know that ammonia is a product that is comprised of the breakdown of proteins. It's a byproduct or waste product. So these kidney stones can be composed of these magnesium ammonium phosphates. And they also crystallize and form a hardened stone. They can again vary in size from very tiny to very large. The next type of stones we're going to talk about are called uric acid stones. These stones are actually formed as byproducts when we think about our ammonium waste or nitrate products and diets that are very high in purines or tyramines. And those are your animal products, those are your smoked meats, smoked cheeses, lots of those very rich, smoky type foods will cause an increase or rise in your uric acid levels. Okay, we haven't talked about gout yet, but also when you have a client that has an increased risk for gout or has a high uric acid level or high uric acid serum level, then those clients also can develop a condition called gout. So whenever a client does have gout, we're also considering the fact that they may be at an increased risk of developing kidney stones. Our next type of kidney stone that we're going to talk about today is called a cystine stones. And these stones are made of animal protein. They're comprised of animal proteins, and what we're talking about is our red meats that are broken down, those really high protein animal fat and animal meat. Generally we think more so related to your red meats. Okay, so clients that do have a high risk for developing kidney stones need some diet modification. A lower protein diet will help decrease some of these different types of stones. When we further look at the diet, we're also looking at the type of stone that was developed. Diet, according to studies, it's not necessarily proven that a diet high in calcium increases the risk of calcium oxalate stones, but if we know that our client already has been diagnosed with these calcium oxalate stones, then what we need to do is make sure that they are limiting that amount of calcium, which could come from their milk, yogurt, cheeses, and those kinds of foods. So depending upon the type of diagnosis or type of stone that's actually been identified, then we would make our necessary dietary modifications. We all know that hydration is very, very important. Unless your client actually has a limitation or fluid restriction, then one of the major things that we need to do is encourage hydration with our clients. Okay, so we've talked about the different kinds of stones. Now let's talk a little bit about what actually happens when the actual obstruction occurs in the kidney. what some of the most common presenting types of complaints from your clients are going to be flank pain, and no, that doesn't mean in the buttock area. That is in the upper back near the rib cage area, especially on the right side, and that is called CVA tenderness or flank pain, and that usually becomes a severe colicky type pain that may come in waves or may be very constant. That is one of your most typical complaints from your client. Clients also may complain about having blood in the urine or dysuria, that painful urination. A condition happens whenever there is a blockage in the ureter pathway. And remember, we have two kidneys, we have two ureters, one on either side, that connect to the bladder, which is the housing unit or storehouse for the urine itself. And then it goes through the urethra and then is excreted out of the body as waste. Well, whenever we have a blockage in any of those ureter areas, either on the right side or the left side, then that can cause a colicky reflux condition, which can cause hydronephrosis to the kidneys. Okay, we think back about our structure of our kidney. Our kidney has nephrons and glomeruli. Okay, and your nephrons are always working very, very hard. Your glomeruli are also working very, very hard. They're filtering and also helping to actually produce the urine. There are millions and millions of glomeruli in your kidney that are doing the functional work. So if we have an obstruction, or say a kidney stone or blockage that has gotten large enough where it actually impedes the flow of urine through that ureter structure, then that is called hydronephrosis. And that means that we have urine that is actually backflowing or refluxing back into that kidney, and that is going to be abnormal. So that's going to cause the kidney to become enlarged and inflamed, and then start doing a sort of a domino effect and causing a multitude of problems with the body. But usually that very first complaint the client has is that severe colicky, doubled over pain. Your client also may complain about having nausea or vomiting associated. And we talked about hematuria. A few lectures back we had talked about different colors of urine and what those may indicate. In this particular client, we usually see a smoky, hazy, or what we call a turbid urine, because it also could indicate that there's an infection. So the smoky, hazy urine is usually pretty classic, that goes along with kidney stones. Okay, we're talking about medications to actually relieve pain. The number one medication that's prescribed by the healthcare provider is usually a morphine or opioid type analgesic, because these work very good for pain management. Another medication is called Toradol or ketorolac, 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 that is used to help intermittently. That is a non-steroidal anti-inflammatory drug that's used along with the opioid analgesia to help with breakthrough pain for your clients. So what we have to do as nurses, and we think about our nursing interventions for these clients, pain management is huge, because they're not actually going to be able to pass that stone until they actually get their bodies relaxed enough to be able to go ahead and allow that urinary system to work. Sometimes the stones may even be too large and require some additional interventions from your healthcare provider. Let's go ahead and talk about another medication, and that is called oxybutynin. And that medication is actually a medication that's used to help reduce spasms, and that can help during the time a client is trying to expel or trying to rid the body of the actual kidney stones. Primarily what we want to do with these clients is make sure that they're receiving a lot of hydration. You know, they're probably going to be nauseated, they're going to be sick, so they're really probably not going to be interested in eating. So we do have to make sure that we're keeping them very well hydrated. If they're not able to take in fluids by mouth, then we need to make sure that they are taking in fluids by IV, if that's what the healthcare provider has ordered for these clients. when we're thinking about actual passage of the urine or passage of the kidney stone through the bladder or bladder stone, wherever the obstruction is located, again, the hydration is going to be very important. Remember that we talked about the importance of keeping accurate, very accurate actually, intake and output, or your eyes and nose, recording the amount of intake and watching the amount of output. It's also going to be extremely important for clients that have kidney stones to strain every bit of urine. If they're not actually hospitalized at the time and they are at home, we also want to make sure that they are straining the urine, because what we need to do is actually look at the urine, and that is going to help us identify whether or not the stones have been passed. Once the stones have been passed, the healthcare provider may actually order that urine or those crystals to be sent to the lab or pathology to be analyzed to determine, from the different kinds we talked about today, to decide exactly which specific type of stone that it is or is present. Many stones can be smooth or rough in structure. Some have the spiculated or spines almost. If you know what a cockle burr is, imagine that traveling through the tiny urethra and traveling through your tiny ureters, and also that rumbling around in the bladder causing a lot of pain, and that's why your clients are so uncomfortable, because these are very, very painful. So we have to offer a lot of support to our clients and also provide pain medication for pain management, make sure that we're keeping them well hydrated, and then after the fact we need to make sure that they're having diet modifications that are necessary to help deal and to cope to prevent further problems with uric acid stones or other types of kidney stones. The next thing I want to talk with you about is lithotripsy. I'll spell that out for you. It's Lithotripsy. Lithotripsy, or extracorporeal shockwave lithotripsy. And this happens or takes place because the client is actually not able to pass the stone, or it may be a severe blockage where they're having a lot of pain with reflux, and we need to act more emergently to get those stones out. And the client will be placed kind of like in almost like bath water, and then they will have some electrodes applied, and then we'll receive what we call a shock wave, and essentially that's what it is, kind of a little, I hate to say the word that it being electrocuted actually, but that actually is what's taking place. The client is receiving that shock wave therapy that's going to help break up those stones if there are multiple stones, or if there is a large stone that cannot be passed. So those types of treatments are available. What we need to tell our clients after they have shock wave therapy or the lithotripsy therapy, that they can have bruising in the site of where the shock wave was received, or where the electrodes were applied. So we need to tell them on the front end what's going to happen, so they won't be alarmed on the back end and see that this and feel that that's something that's going to be abnormal. We also need to tell them to anticipate having hematuria or bloody urine for several days after having the lithotripsy. Again, we need to intervene with diet modifications and also good hydration. That's going to be very, very important for these clients. Okay. Next, there is another surgery that can be done called a lithotomy, and depending upon the location of where the stone is located, if it's in the kidney itself, it's a pyelolithotomy. If it's in the kidney, also depending upon the location, can be a nephrolithotomy, or ureterolithotomy, or even the bladder can be opened if that becomes the case where the bladder is actually completely obstructed. So in order for the stones to be removed, surgical management can take place. So we have to think about what entails after we've had a surgical procedure. Then we're always concerned about bleeding. We would anticipate that the client may have some hematuria or some blood in the urine, but we also need to be managing the kidney and how the placement of the client after the surgery, and then watching very carefully for hemorrhage from that particular site. Again, monitoring the vital signs of the client is going to be of utmost importance, because those are clues and factors that tell us whether or not the client may be developing an infection. We're also monitoring lab work very carefully, because our H&H, our hemoglobin and hematocrit, can also indicate to us whether or not our client may be having an internal hemorrhage, something that we can't actually see. I hope that you'll join me again next time, as we're going to be talking about labs that are associated with clients with kidney problems or renal failure, and we're going to discuss those in detail. So again, stay tuned. Our next video is going to entail labs. Thank you.